Medicine and Toilet Preparation Act. Now in this lecture we will complete that is Medical Termination of Pregnancy Act 1971. In this lecture we will complete that medical termination of pregnancy. This is also very important topic on the point of view of different competitive exam such as GPAT, NIPAR, CRE, AIMS and RRB pharmacist and drug inspector. Okay, so you will see so many questions from this topic. This is a very important topic. Let's start the medical termination of pregnancy. Until that we have completed yesterday. Yes or no? So let's start medical termination of pregnancy. Am I audible or not? First select the marker, then highlighter, and yeah, let's start. So medical termination of pregnancy is very important topic. Yes or no? So this medical termination of pregnancy act came into, that is passed in 1971, but it came into force in 1974. So MTP, medical termination of pregnancy, passed in 1971 and it came into force in 1975. Okay. Next, what are the rule? The main objective to control and regulate the termination of pregnancies or abortions. Okay. Guardian, who are the guardian? The person who cares for the minors are simply called guardian. And what is lunatic? It is mentally ill person. Okay. So registered medical practitioner who registered in Medical Council of India, that is MCI, or National Medical Council, that is NMC. So where the termination of pregnancy takes place. So in that condition, there should be the three conditions. The first condition is health aspect. So pregnancy arises due to the sexual crime or rape or such any condition, etc. If the pregnancy arises due to sexual crime or rape, in that case, due to the health aspect, that medical termination of pregnancy can be done. Number two condition is eugenic aspect, that is pregnancy causes fetal abnormalities. And number three, humanitarian aspect. So humanitarian aspect in the sense pregnancy gives to damage or death of mother and baby. Pregnancy gives to damage or death of either mother or baby. Can you please give me one? So next we'll see who terminates the pregnancies, who is eligible. So number one condition for that, one registered medical practitioner for 12 weeks. What is that 12 week? For 12 week of pregnancy. So for the termination of a 12-week pregnant woman or termination of a 12-week pregnancy, a registered medical practitioner is needed. And for more than 12 weeks, up to 20 weeks, two registered medical practitioners are required. How many? Two registered practitioners for more than 12 weeks. You have to see that. For 12 weeks only, one registered practitioner is enough. But more than 12 weeks and up to 20 weeks, two registered medical practitioners are needed. Okay. The person age must be above 18 years. The person who is doing the termination should have the age of above 18 years. In case of minor, take permission from guardian. If the girl is below 18 years, that is minor, then you have to take permission from the guardian and then you can do the termination of the pregnancy. Now, where the termination of pregnancies takes place? So number one is government or private hospital, but the premises or the area should be safe and hygiene. It should be safe and hygiene. Okay. Next, what are the requirements for the termination of pregnancy? So number one requirement is anesthesia equipment and surgical instruments. Anesthesia equipment and surgical instruments. Number 2 is emergency fluids, and number 3 is lever table. So these three are the requirement, main important requirement, necessary requirement for the medical termination of pregnancy. Number 1 is anesthesia equipment and surgical instruments. Number 2 is emergency fluids, and number 3 are lever table. Okay. Next, qualifications. So what are the qualifications required for the medical termination of pregnancy? That means the person who will do the MTP, what are the qualifications needed for him to do the MTP? So the first thing is, before this act, minimum 3 years experience, minimum 3 years experience in OBG. OBG means obstetrics and gynecology. Obs-gyne. So that's obs-gyne. OBG is obs-gyne. So before this act, minimum 3 years of experience was required. But after this act, which act? Medical and Medical and Termination of Pregnancy Act 1971. After this act, MBBS with 6 months of house surgeon in obs-gyne. MBBS with 6 months, you have to focus on that, with 6 months of house surgeon in obs-gyne and 1 year experience in obs-gyne, plus MBBS, plus minimum 20 termination experience, minimum 20 termination of pregnancy assisted. It is not done by the MBBS, it should be assisted with the registered medical practitioner. Or the other person who can do that is PG in obs-gyne and MD in OBG. PG in obs-gyne and MD in OBG. So this is very important. From this actually question are asked. This topic is very important. You have to remember that one. What are the qualifications required? You have to focus on that again. Please repeat after me. So what are the qualifications required for the medical termination of pregnancy? So the person who will do that medical termination of pregnancy, what are the qualifications required for him? The first thing, before this medical termination of pregnancy act, before this act, minimum 3 year experience was required in obs-gyne. But after this act, that was before 3, but after this act, now MBBS with 6 months house surgeon in obs-gyne and 1 year experience in obs-gyne. MBBS with minimum 6 months of house surgeon in obs-gyne and 1 year of experience of obs-gyne. Along with that, minimum 20 termination of pregnancy assisted. It is not done, it is assisted. You have to focus on that, assisted with the registered medical practitioner. So the person who will do the MTP before the MTP Act 1971, which came into force in 1975, before that rule, the experience should be minimum of 3 years experience. But now after the rule came into act, now MBBS with 6 months house surgeon in obs-gyne required. Along with that, another MBBS with 1 year experience in obs-gyne, plus that person should have the experience in 20 termination when he was assisting the other person, and that other person was medical registered practitioner or registered medical practitioner. Okay, am I clear? Am I clear? That person should have 6 months of house surgeon obs-gyne and 1 year of experience in obs-gyne, and that person should have that much experience that he would already earlier assisted another person who was the registered medical practitioner. He assisted that registered medical practitioner for 20 terminations. For how much? For 20 terminations he assisted. He didn't do that, but he assisted the medical registered practitioner. Okay. Or the other person who is having PG in obs-gyne or MD in obs-gyne, he can also do that medical termination of pregnancy. Okay. Now we will see Medical Termination of Pregnancy Act in 1971 and Medical Termination of Pregnancy Act in 2021. What are the difference between that two, MTP 2021 and 1971? The number one thing is that Medical Termination of Pregnancy 1971 was applicable to married women only. Only married women. But now after 2021, both married and unmarried women. Now both married and unmarried women. Next, medical termination of pregnancy 1971 was termination pregnancies was for 20 weeks for all condition. 20 weeks for all condition was acceptable. But now This is 24 weeks of rape survivor. Beyond 24 weeks, if a person is there, then fetal abnormalities. Fetal abnormalities, that is humanitarian. Already I mentioned earlier. Okay, and 24 weeks, up to 24 weeks, rape survivor, and beyond 24 weeks for fetal abnormalities. That is according to Medical Termination of Pregnancy 2021. And according to Medical Termination of Pregnancy 1971, it was applicable up to 20 weeks for all conditions. Okay. Next, medical precision opinion for the termination of pregnancy. Who can do that? Simply, who can do the termination of pregnancy? According to Medical Termination of Pregnancy 1971 rule, one RMP, that is one registered medical practitioner, can do that, and he can do that for up to 12 weeks of pregnancy. But two registered medical practitioners are required for 12 to 20 weeks. That is, up to 12 week, one registered medical practitioner is required. But when it is more than 12 week, and up to 20 week, two registered medical practitioner are required. That condition is according to MTP 1971. But now, recently in 1921, according to that MTP 1921 rule, one RMP can do the MTP up to 20 weeks, and two RMP can do that up to 22 to 24 weeks. Up to 20 weeks, only one RMP can do that, but two RMP are required for a pregnancy of 20 to up to 24 weeks. Am I clear? I hope you people are clear very well. Okay, beyond these weeks, like beyond 24 weeks, medical board approval is required. Okay, if they are doing any misactivity or breaching of the woman confidentiality, then 1000 rupees fine, and that fine was according to MTP 1971. So according to MTP 1971, breaching of woman confidentiality can lead to 1000 rupees fine. But now, according to MTP 2021, it is up to 10,000 fined, along with that 6 months of imprisonment. So medical termination of pregnancy 2021, according to Medical Termination of Pregnancy 2021, breaching of woman confidentiality will lead to 10,000 fine, along with that 6 months of imprisonment. 10,000 fine and 6 month imprisonment. Am I clear? You have to remember these things. These are very, very important. These things all are related to rules and conditions and rule and law, and you know it very well. DI is all about rule and law. Yes or no? So that's why these things are very, very important for the point of view of drug inspector exam. So you have to remember that properly. Okay na? Okay. Next we will see the termination of pregnancy registered is maintained by the owner of these are the golden key points you have to remember. So the termination pregnancy register is maintained by the owner of the hospital. Who will maintain the register of termination of pregnancy? The register of medical termination of pregnancy will be maintained by the owner of the hospital, and the inspection of register, and it is opened in the presence of 3 members only. The inspection of the register or opening of that register can be done in presence of 3 people only. And who are that 3 people? Number 1 is Chief Secretary of the State, number 2 is First Class Magistrate, and number 3 is District Magistrate. So Chief Secretary of the State, that is CS, First Class Magistrate, that is Judge, and Chief Magistrate, that is also Judge. In front of these First Class Magistrates, Chief Justice, and District Magistrates, Chief Secretary and District Magistrate, only the inspection can be done. Inspection or the opening of the register can be done in front of these 3 members only. Beyond, apart from these 3 members, or if these 3 members are not there, then no one can force to open the register. Now, what are the penalties? What are the main penalties? So termination of pregnancies is done by unregistered person. If this is the important golden key point. If the termination of pregnancy is done by unregistered person, then fine 7 years of imprisonment, 7 years of imprisonment, and along with that fine will be there. 7 years of imprisonment and along with that fine will be there. So up to this, these are the most very important points that are golden key point for different competitive exam. Golden key point. Okay, so you have to remember all these points. Okay. Okay, thank you for being connected with me and study hard. Keep revising continuously. Follow 147 rule. I will explain you one day what is 147 rule. Okay, all the very best. Keep studying and let's hope for the best. Thank you.